What's the most out of line thing a doctor has ever said to you? A gentleman I worked with showed up to work one day looking extremely sick. He was incredibly feverish, had muscle and joint aches, very lethargic and was looking very jaundiced. We insisted that he go to the doctor, as he looks like he is on death's door. He told us that he had been to 2 separate doctors in the year, letting them know that he has malaria and can they please give him some anti-malarials. Both doctors in the year insisted that it was impossible to have malaria, as Australia doesn't have malaria, and that he probably just had the flu or some other viral infection. And they are correct. We don't have malaria here. But what they failed to grasp was that this gentleman was an expat who worked in Africa for a number of years and has had malaria 5 times already. So not only is he an expert in what malaria feels like, but he is also at risk of developing malaria again. Even if he hasn't been to Africa in a few years. He ended up having to go back to the and basically force them to run a test for malaria, after which they were like, oh wow, you do have malaria. And he was like, no shit, I told you that 2 days ago. This kind of thing drives me crazy. Just a little vent. But I have had doctors tell me what my issue is, and I have debated with them, and they still insist. I get a course of treatment, and it doesn't work. At this point, I have paid for the visit and the treatment, and now, guess what? I need another appointment and another treatment for the thing I actually think it is. And I get to pay twice. Someone is winning here, and it's not patients. I had smashed my face on my steering wheel during a bad car accident and was experiencing intense pain. I teared up when he put the scope in my nose and was told I obviously have psychological problems, and if I went on medication it might not help my pain. But I wouldn't care as much. Finally found a good doctor and surgery removed the chunk of nose bone that was stabbing into a nerve in my face. Years ago, one of the sexual health nurses at my work told me she just saw a woman who very clearly had a scabies infestation around her genitals. She said the treatment was simple and that a cream was applied with almost instant relief. She said what upset her about that patient was that almost a year earlier she'd been to a doctor about the infestation. The doctor didn't even inspect her and just prescribed her antidepressants. I was horrified and still am over 7 years later. So much medical gaslighting. A whole year dealing with scabies in her genitals. OMG. I had a growth on my scalp a few years ago and went to see a skin cancer specialist who said it was a melanoma and I was going to need most of my scalp removed. Without even having a biopsy, he starts telling me to prepare myself for this surgery that will disfigure me. I was about 19 at the time with long hair. He stares saying I'll need to wear a wig and my hair may not grow back and the skin above my eyes will need to be removed. I was petrified. Went home in tears and absolutely petrified. Then my dad took me to his doctor, who took a biopsy. It was just a random skin growth and she cut it off then and there. Far out. Bruh, imagine you went through with it and got scalped for nothing. Holy yes. Not one, but 2 doctors to my dad, you're too young to have prostate cancer. No need for a biopsy. It's just a bladder problem. He died 15 months later from an aggressive prostate cancer that spread to create tumors all over his body. Edit. Thank you for the award and the well wishes. Father's Day is always hard for me. Please keep an eye on your prostate and get checked when appropriate. Yeah, that happened to a friend of mine. She was sick and it was obvious. Her skin and eyes were yellow and she kept pooping diarrhea all the time. The doctor ran some tests and said, "You're just getting old." Dead in a few months later from stage 4 stomach cancer. When you start turning the color of Homer Simpson, a doctor should be smart enough to know something is not right. While teaching abroad in Vietnam, I was struggling with depression. The doc diagnosed me with homesickness and prescribed a box of 160 hydrocodone to take when I feel sad. I was 21 and this was 2007. Way before pill use was talked about mainstream. Subsequent boxes were $12 each at a walk-up pharmacy. No script needed. I became addicted for 6 years. Edit. As I have many people stating that pill use has been discussed forever, I'm talking about the point we got to where most people knew about the dangers of opioids. What the main ones were. The fact that they were being overprescribed, etc. Had I heard the word hydrocodone, and been exposed to the world and media, like I have over the last decade with the spotlight on the opioid crisis, I would never have taken them. That's the main point I was attempting to make. Man. That will do it certainly. I have a somewhat similar story in that, when I got my wisdom teeth pulled out at 20 years old, and no experience with opiates, I was prescribed Darvocet and 3 bottles of codeine cough syrup from one doctor, and a bunch of Percocet and hydrocodone from another. I was high every day for the next 2 months, and it didn't take long after that for me to move on to methadone, and then heroin/fentanyl. I sincerely hope you're doing better these days. Fortunately I am. But I wonder what my life would have been like had I been more responsibly prescribed pain meds, or at least given some indication/warning of what I was getting into. That's an insane amount of medication for wisdom teeth removal. Worse than street dealers GBH. At least then there is no illusion that what you're taking is safe. I'm glad you pulled through it though. Mentioned that my sex drive was abnormally low tonight, and she said my husband just needed to be more forceful when initiating, and I'd get into it. Immediately switched doctors and never looked back. Mine was the opposite, moved and went to a new gym that several women raved about. I expressed concern over low sex drive, especially since I was only 25. The next thing I know she is giving speeches and pamphlets and trying to give me info on women's shelters. I was so confused. She just jumped to the conclusion I must be a battered woman, no matter what I said. She was convinced I was being abused. I tried to reassure her no. Husband was definitely not the problem, and he was actually quite good in bed and extremely attentive to my needs. It was clearly a physical problem. She just pulled not hear out, even after I went into very vulgar and specific details to explain why I thought it was a physical problem. Never went back. She even called several times to check on me. I get that some women may need this, but I mean there was literally no red flags. Quite the opposite. It was weird. Edit. Fixed a typo. I'm always so conflicted about these stories, because on one hand, that's borderline harassment. On the other, I do want doctors to be paying attention and willing to help women who actually are in those situations. Doctors who only talk over people and don't even let them speak because they already have a fixed idea in their head, and because of that aren't willing to even listen to you, aren't actually doctors who end up helping victims, because they are evidently both bad at realizing actual signs and also bad at talking to people. This completely fine person who isn't in a bad relationship felt basically harassed. That's not an environment that will encourage an actual victim to talk. Not a doctor, but a dentist. When I was like 13 or 14, he commented on my lack of gag reflex, telling me that I'm going to be very popular with the boys. It took me a few years to realize what he meant by that. I was the opposite. My dentist said, if you always gag like that, you're never going to find a good husband. I didn't understand why my mom yanked me out of the dentist's chair, but I'm proud of her for that. I think I was 6 or 7 years old. Damn. That's cool. For me it was the opposite, mom joking about how much I was going to hate my gag reflex when I got older, while the doctor looked uncomfortable. Oh gosh, that's gross. Mental health doctor told my daughter, "You're too pretty to be depressed." After the appointment, on the ride home, she said she felt stupid. She needed to be heard and her concerns validated about the depression she was experiencing. Instead, she said she felt like she was wasting everyone's time because the doctor made her feel as though she really had no reason to be depressed, regardless of intentions. The effect of the doctor's statement was to push her further into her depression. She felt like not even a professional would admit she needed help. Fortunately, we found another doctor who has worked with my daughter and helped her out of that dark period of her life. She tells me now that she actually feels pretty because she feels so much better in the inside. I'm so sorry that your daughter had to experience that. What that doctor said is really upsetting. But that last line that says she actually feels pretty because she feels so much better on the inside warmed my heart. I'm so glad that your daughter is better now. They gave me the wrong standard test results. My OBGYN sent my STD test results in the mail to my dad and stepmom, who I do not get along with, even though I've never lived with them and never gave the doctor their address. My stepmom of course opened and read the results. Fortunately I did not have an STD, but she made all kinds of assumptions about why I would need to take that test. Thanks document. My parents also saw that I got tested for STDs, but it was because I was on their insurance. It wasn't the results, but an itemized bill. They just asked if I was okay. I'm in my mid-30s, married, and I'm on my own insurance through my employer, have been for 14 years. So it made absolutely no sense for them to mail my private health info to my dad. That's a major F up and the basis of a lawsuit. Went to go get tested for celiac. Doctor runs the blood test and it comes back that I have it. She asked if I was sexually active and I said no. She read my results, basically told me I have celiac, but all my celiac symptoms were cause I was lying about my activity and they were all in my head. Told me to see the IBGYN and go to group therapy. Not that bad, but it gives my new doctors a laugh when I tell them, what does celiac disease have to do with fucking? I also would like to see that line of logic. Not a doctor, but a nurse. I was miscarrying, dying, and had to have an emergency D&C. I was struggling to get ready to go to the OR because I was in so much pain and couldn't stop crying and hyperventilating. I think I was having an anxiety attack. IDK. She said, oh stop it. It's not like you can't get pregnant again. Edit. Thanks so much for all the responses to this. I'm not sure I have the emotional bandwidth to respond to everyone, but my heart is breaking for everyone that experienced something like this. I'm so sorry. This happened with my wife at 18 weeks. They flushed our baby down the toilet. My wife had a circlage, and they argued for 45 minutes about whether to cut the stitches open in the labor and delivery unit or in the ER. And while they were arguing, my wife ran into the restroom and ended up miscarrying while sitting on the toilet. This ripped her cervix wide open. They then performed surgery to fix it, but actually cut off and removed a large portion of it, rendering her cervix completely unable to ever function properly again. The hospital clearly violated any sort of standard of care, violated state law by improperly handling the deceased baby, because 18 weeks in our state is legally a baby and should be handled as any other human. They conveniently lost the sign-in log and the video footage from the labor and delivery entrance, and claimed that they never did any surgery on her cervix. They then billed our insurance for the surgery they say they never did. And when I asked to see the medical records from that surgery, they refused to show me any. I reported them for insurance fraud, and all of a sudden they were 100% sure that those medical records did not exist and the whole thing was a paperwork error, that no surgery ever happened. I talked to multiple lawyers and only one took our case, and ultimately he told us there was nothing he could do because there wasn't any evidence that we were ever at the hospital that day. So my 18-week baby disappeared and my wife has a destroyed cervix which has obviously been surgically altered, and I got billed for the procedure because of a paperwork error the next time in that hospital, a month after the original due date. And since they deleted every trace of the miscarriage and of us being there, they asked how our new baby was doing. I wanted to burn the goddamn building to the ground. Ultimately he told us there was nothing he could do because there wasn't any evidence that we were ever at the hospital that day. When did this occur? Because cell phones definitely store location data. Cell phones have really only been a thing for about a decade. If Op is in their late 30s/early 40s, and this happened in the zeros, then he likely did not have a cell phone. Not a doctor, but a nurse told me that I shouldn't exercise to raise my heart rate because my heart has a fixed number of beats in it before it goes out. What? That is some old time superstition people used to believe, like the earth is flat. But even that made a comeback. Even so, following that train of logic, you're still losing more years by not exercising. If you need it, then you'd lose if your heart did actually have a static set lifespan. That my period wasn't that bad and I was fine taking 18 Advil a day, then telling me she could just sterilize me and cramps would go away. She wouldn't prescribe me anything for pain and said if I wanted drugs to go somewhere else. So I did. The next doctor suggested an IUD, which was the right solution. 18 Advil a day. Hope you didn't do that for too long, or you may be dealing with GERD. I did it for way too long, and I had terrible GERD. I ended up having weight loss surgery and a hernia repair, and ever since, no GERD or heartburn. Till I have GERD. Mostly from unhealthy eating habits. Drinking and smoking too much. Interesting. I remember it stopped when I started doing keto and exercising more. So much heartburn all the time. I was with my girlfriend at a clinic and the old male doctor asked her if her period was regular and then asked me if her period made her bitchy. If the nurse's glare contained heat, that asshole would have combusted. Sounds like an I beg your fucking pardon was in order. Did anyone challenge him? You'd be amazed how little sass you have in the exam room of an abortion clinic. That's even worse. F him. He unhooked my front clothes bra while listening to my heart/lungs with the stethoscope. He then suggested he give me a pelvic exam and kept pushing even after I said I had a gen already and was up to date. Yeah, that's not normal behavior for a doc at all. That is not how they measure pants. It is in prison. Before bandaging up my hand after a carpal tunnel op, asked me to test it by picking up my phone, then opening the camera app without warning. He whipped out a quarter code and asked me to leave him a review on Google and TripAdvisor, as it was the first time he'd done that surgery. This is like every YouTuber ever. Don't forget to like and hit that bell to subscribe, it really helps the channel. I'll lance your cyst because I'm a fucking cowboy. It was a tumor. Anytime a doctor refers to themselves as a cowboy, bad news bears. Yeah. Thankfully I stopped seeing him shortly after that. After standing in the hallway outside the room, loudly talking football with someone else for over 15 minutes, the doc walks into my room, tells me he does not have time to address my health concerns and will refer me to a specialist if I want, then leaves. Less than 3 minutes in the room, I reported him to both the medical group he was a part of, their parent medical group, and requested a change of physician with my insurance company that day. I don't know what happened to him, but if he made a habit of that with other patients, I hope he was fired. This is one case where I could see the insurance/hospital coming after the doctor, not because he didn't give you the appropriate amount of time, but I'll bet he'd charge for it. I paid my copay on the way in. He refused care. Basically, I went in to discuss a specific issue, which he refused to discuss. Send him a $50 missed visit fee on an invoice. Went in for kidney stones at 18. It was my second. I was sitting there telling him what was going on, and he was like, if you really had kidney stones, you would be doubled over on the floor in pain right now. When I explained I had taken both of my remaining Vicodin as one wasn't cutting it, he just said he was going to look at my UA. Came back in a few minutes with a very apologetic tone. Explained how there was a lot of blood in my urine, and sympathized with me as he's had them in the past. If that's true, how are you not crippled by pain right now? 2 Vicodin, oh yeah. That'll do it. Back in a tick. Apostrophe. I've gotten similar as someone who lives with chronic pain from arthritis. What people don't understand is that you eventually get used to the pain. You won't be screaming from it anymore, but it still really fucking hurts. But doctors will just assume you're fine because you're not screaming at the top of your lungs like a maniac. I hate doctors. Before I was diagnosed with arthritis, I had a doctor tell me for a whole year that I was too young to have it at 25. Said I would not be able to get out of bed for hours in the morning from being doubled over in agony. When I told him that was exactly my situation every morning, he literally just said no. I don't know if I've ever wanted to bash someone's fucking brains in more than I did in that moment. I finally got a script for a rheumatologist and was diagnosed in 2 visits. F doctors that can't admit when they are wrong. FM in the ass with an arthritis-inducing cactus. That I was faking it because I needed attention after my mom died. Covered him in puke 10 minutes later, so I'm good. Excellent work. When I was 13 I got mono from drinking the same water bottle as my friend. Mono is known here as the kissing disease, and when I was sick I got shamed for it. I went to the doctor, and he was an old man who said I'm not surprised a pretty girl like you has mono. It was so creepy. I was 13. Alone in the exam room with him basically. I got mono at 30 years old and the doctor asked if I'd been kissing aunties at birthday parties. We both laughed pretty hard. But WTF dude. No idea why, but that is low-key a funnier question. Also WTF dude. I had the worst doctor that my mother forced me to go to through childhood and young adulthood until I told them both to F off. Some of the worst offenses were telling my mother I had herpes immediately after my first forced gyn appointment when in it was literally razor burn. Telling me I'm just being over dramatic because I was experiencing intense pain in my bladder randomly. Ended up being a slew of bladder issues she never bothered to check for. Because once my urine sample showed no infection, she assumed I was just literally passing out from pain for fun, insisting I take medication for ringworm when I didn't have, never had, and was never tested or checked for ringworm, testing me for strep throat, giving me no medication, and then gaslighting me about it when I ended up so ill from untreated strep throat that I was nearly hospitalized. This doctor also did a gyn exam on a close friend when she first became sexually active. After my friend expressed discomfort during the exam, she replied, "Well, your boyfriend must not be very big. If this hurts, needless to say, I do not wish her well." That's also disgusting to read, and I'm glad you told them both to F off. I had an obgyn that was equally awful. She'd make sarcastic comments when I was in pain during exams. The speculum was like torture to me. She said that I was being dramatic since I'd given birth vaginally before I found a new gyn. Thankfully, I told her what happened with the previous doctor. She used a smaller, child-sized speculum, and I was diagnosed with vaginismus shortly after. Come to find out, that first doctor had given me a husband stitch after I'd had my son. It took years and a lot of physical therapy to get past that. OMG. I'm horrified for you. I'm so glad you found someone better. Why do some doctors have to suck so badly? After a late first term miscarriage, don't be too sad. At least you know you can get pregnant. The nurse next to me visibly cringed. I wish I had reacted more forcefully, but I just sat there and said nothing. I really wonder if people who say this would say the same thing if a birth child died. Oh well, just make another one. Honestly, I can't believe how insensitive some people are to a miscarriage. It's horrible. Would say it was out of line, but just really dumb. But I remember when I was younger, a doctor said to my mum when she came in with me for an appointment that people in this country, the UK BTW, can't get malnourished. It's impossible. Wow, that doctor needs to go back to school. There is nothing wrong with you. Your problem is right here, as he points to his head, then proceeds to recommend a religious radio station. I only timidly asked about some unexplained bruises appearing on the tops of my thighs. Another doctor asked me out when removing a mole. When I was in the Marines, I went to the doctor to complain about persistent knee and back pain. I had tweaked my lower back pretty bad being dumb trying to move a generator. The doctor told me I was lying. I know some people try to exploit the system to score some free pain pills, but I explained I didn't even care to get any pills. Just wanted it noted in my medical record in case it got worse. Maybe give me some advice on how to manage it. Maybe some stretching exercises. Nope. Just you're lying. Get out of my office. It was the first and last time I ever went to a non-base/military doctor. You don't need antidepressant drugs. You just need to surrender to Jesus. He has a plan for you. Real doctor comment. Close bracket. This doctor should be fired. I do wonder what's supposed to happen in a nurse setting. I feel for the fact that they have to see so many different types of patients, and many of them are real pains in the ear. People who have ignored symptoms and signs forever and now come to the ER at 3 AM with a gangrenous hole in their leg from untreated diabetes, for instance. But I have had some real dust-ups with docs who were condescending, dismissive, or just plain mean when I had to take my parents in. I have been prescribed a book before. It probably interacts with warfarin anyway. Thinking about warfarin interacts with warfarin. Serves you right for being sick on a bank holiday. He said that to me despite my screaming in pain as he said I couldn't have scan. I hope he explodes. Gonna start saying this when people annoy me. Doc, that's a 3rd-degree burn on your finger. Me, no. I would know if I got that bad of a burn. Doc, that is a 3rd-degree burn. Me, I didn't burn my finger. Doc, come back if it spreads to your arms. Turns out I was impetigo that I'd caught from one of the kids in my care at a summer camp. Not to me, but I heard another doctor say to an obviously emotional woman that was having an active miscarriage, "It'll be okay. You still have 2 other kids, right?" I told him afterward what a shitty thing to say to someone experiencing the loss of a baby, but he didn't really absorb it. Thanks for correcting your colleague. I feel bad for the patients on this thread who feel like they should have called out doctors and nurses on their insensitive comments about miscarriage. It shouldn't be the job of a grieving parent to teach some sensitivity to medical professionals. As a teenager, I went to a doctor for a sore throat. I thought I might have had strep throat. Anyway, as he was examining my throat, he starts asking if I have regular periods. Not sure what that had to do with a sore throat. I replied, "Yes, I get one every month. They average about every 24 days. When I use the word average, he thought my periods were indeed irregular. He says to me, "You will never be able to have children." I so wanted to say, "Okay doc, now that you've given me a totally irrelevant diagnosis, are you gonna look up Maya to see if I have strep throat?" It's so dangerous to tell people this in some random offhanded comment with zero testing. I can't tell you how many stories I've heard of people thinking they were infertile because a doctor told them they probably couldn't have kids and then boom. Accidental surprise pregnancy. I know someone who had severe PCOS, had to have an ovary removed, then was told she was infertile due to the PCOS. Fed she went on the pill to manage periods, and then got pregnant. Then was in a coma for 2 days after giving birth. Then she got the implant and got pregnant again. Then she got an IUD and got pregnant again. Not even an ectopic pregnancy. This was a normal pregnancy. She ended up getting sterilized so she wouldn't have more kids. Jesus God. What an absolute nightmare. Not me, but my cousin's wife. She's from the Caribbean, and she was seeing the doctor, male, shortly after having her first baby. He said, "Bet that baby loves chocolate milk." Immediately switched doctors. Horrible. No need to be tested, but I'll do it if you want to. Women don't get sts, it was said to a friend of mine. But it's too outrageous to not share it. Might have been my former doctor. Told me I didn't need to get tested because I don't have gay sex. Got a full ST panel done privately after finding out my ex was actively trying to cheat on me at every opportunity, and I don't know if he succeeded. It was an at-home test and I couldn't get enough blood out of my fingers for the vial. So asked my GP if they could take blood for the syphilis/HIV test. GP said no, but kicked up a fuss when I pressed it. Questioned why I even needed it done. Was I showing symptoms, etc. I said because it's recommended by doctors to have regular ST testing, especially before starting a new relationship. He arranged a test on the NHS for me. My obgyn told me that as long as I'm friends with a girl I don't need to get tested for STDs. I wasn't friends with a girl. I was in a lesbian relationship with a woman. And why do I have to tell my obgyn that lesbians can still catch STDs? We wanted to both get tested before being intimate in any way, but she didn't let me. She also told me that it didn't matter that I didn't get my period as a result of my eating disorder, as long as I was losing weight. She's no longer my obgyn. The ignorance of all doctors, but particularly OBGYNs, when it comes to Q relationships is astounding. A nurse once told me that, since nuns had a very low instance of HPV, that meant that PIV was the culprit. So lesbians would also be low risk. I mean, sure, they both generally avoid the D, but there is a big difference between nuns and sexually active lesbians. Don't worry, that's harmless. You just won't look as good in a bikini. Big punch to my self-esteem as a young teen. Similar went to a podiatrist for toenail fungus. He shrugged and said it's not harmful. It's just unsightly. Female. Early 30s. Like my dude. That's why I'm here. Ever heard of tough actin tinactin? Injured my back doing CrossFit in 2012. Woke up a couple days later unable to walk. A doctor told me, while showing me the x-ray, that my backbone is bending the wrong way and I need surgery. Went to an ortho the next day who told me the doctor was holding the x-ray backwards. Turns out I strained the muscles in my lower back and got a 5-day muscle steroid pack that had me waking again after day 2. A doctor who sees a lot of people a day. A doctor. If I was a doctor, That would probably be something that I would end up doing. I can imagine it now. Oh god. This dude's back is so fucked up. Keep cool. Just tell him it's a bit out of place and to see ortho. Ortho. Sorry. He's kind of an idiot. Apostrophe. It's all in your head, before referring me to a psychiatrist. Plot twist. It wasn't just all in my head, and I nearly died. What was going on? If you don't mind my asking. Not at all. Apparently I was anemic, and becoming more and more anemic as each day went by, but didn't know that's what was going on. I only knew that it took very little energy being used before getting tired, and eventually I couldn't walk up a few steps without getting tired. I also have asthma, so I would have trouble breathing after doing whatever made me tired. When I finally convinced my mother to take me to the doctor, he asked what was going on, and I told him that I have been having trouble breathing when doing activities that require me to exert energy, I guess. He immediately asks me, are you afraid of anything? And I reply, the stairs, because like seriously, if I tried to go up a few steps I'd have to stop and take a break or I'd feel like I'd pass out. He tells me it's anxiety, that it's all in my mind, and sends me home. No tests or anything, just sends me home. I wanna say about a week later nothing's getting better, and I ask my mom to take me back. So I see him again, and he asks why I back, and I tell him the same problem is still happening. He again tells me it's just anxiety, and that it's all in my head, and then refers me to a psychiatrist. Fast forward to seeing the psychiatrist, and she asks why do I think I'm here, and I tell her I really don't know and explain what's been going on with me, and one of the first things she tells me is he sent you here without doing any tests. Fast forward some more, I'm at a point where I can't really stand up on my own sometimes and finally get taken to the ER. If I'm remembering correctly, they took some blood and apparently my blood count was so low that had I waited longer I'd be close to death. I was still kinda young at the time, so I didn't really understand the situation, but I guess I'm just happy that's over. JFC, I'm so sorry. I have anxiety and depression, but nothing that causes me any ongoing physical symptoms. I also do not take any medicines for it. By choice. It's not needed emo. Because of stories like yours, I tend not to mention to any doctors that I suffer from either of those things, because they will always be blamed. Told him I rarely play video games, but when I do my thumbs and pointer finger goes numb. He said sounds like you should stop playing video games. 10 years later find out I have carpal tunnel, and if I would have had something done about it back then I wouldn't have the issues I have now. I wake up and I feel like my whole arms are in boiling hot water. Have to shake them out while driving or doing anything with dexterity. If I could find that doctor and break his nose I would. Damn, I have the same issue when I play. Might need to schedule that appointment after all. That doc is seriously an a-hole though. First off, here's some context. Went to the doctor for my ADHD medication update a few weeks ago, and she had asked me if I knew who she was, and when I said my doctor she asked what her name is, and I responded with her name. So she asked me this, IDK if this is odd, so you know who I am. Good, now who are you? Your full name, age, exact birth date, reason you are here, and your height and weight. When I stuttered on it, I have a really bad stutter BTW. She asked me an even weirder question, do you know who you are? Do you know if you're real? Are you sure you are really you? It's all good. Just a common NPC glitch. They do that from time to time. If you walk out of the room, close the door, and walk back in again, it gives the system a chance to reload the simulation. Then just act as if it was your first time in. Me, I've had a migraine for a week solid and wanted to get checked out, doctor. So I guess you think you've got a brain tumor then? My mum died from a brain hemorrhage a few years prior to that visit. I had been to counseling for bereavement and related anxiety and depression. All of this was in my notes. Grade A BTCH. Jump. This was 2 days after an old school appendectomy. Being a dumb kid, I complied. My knees buckled instantly upon landing, and the bastard was ready and caught me as I collapsed. I've worked in healthcare for several years in my life, and I have asked many doctors and the occasional nurse what the medical justification for that may have been, and no one had an answer. Quite a few were skeptical it had happened. Not really sure why they would ask you after the surgery. Jumping before. is one of the old-fashioned tests that actually work. When you jump, it makes the appendix move, which irritates it, causing pain. Thinking of that, maybe there shouldn't be pain after, since the appendix is gone, but you'd still have the surgical site pain. My Gino when I was 17, and he was almost 70. He had me turn my back to him naked, so he could check my spine. First time to Gino and mom was in the waiting room lol. He then says, oh you have a sway back. They look real good in a bikini WTF. Guy shoulder retired years before. I hope you reported that perv. Gynists don't do back exams. I was about to say. Little bit concerning. Being refused sterilization multiple times by different doctors. Was told that my future husband might want them. And how could I possibly know that I didn't want children? They wouldn't let me make a choice about my body, but they'd trust me to raise a child? Still raises my blood pressure at the injustice of it. Stories like this make me glad I'm autistic with genetic diseases. Doctors love restricting BO females' rights to get sterilized, but they love eugenics more. The truth of this hurts so much. Not me but my friend, while in hospital care after a suicide attempt, was kept away from her antidepressants because the doctor didn't think she was really depressed. After a suicide attempt. Like what? He treated her like trash from what the friends who were actually there told me. I was several states away. Disgusting. I hate that being treated terribly for being mentally ill isn't uncommon. Maybe she just thought you had a really cute, but after I told her I was sexually assaulted at 5 years old, that doctor needs to be drop kicked into the fucking void. Oh they deserve worse than that. My hormones were out of whack. I was drinking 300 plus ounces of water a day and still thirsty. I would go to bed with a 32 ounces of water and wake up all night to either drink the water or use the restroom. I slept in 30-minute spurts every night for months. I went to 3 endocrinologists. One told me I was a drama queen, and if you want attention, there are better ways to get it, and you need to lose weight. The second told me you have a stressful job. Get a less stressful job. The third walked and said get off your birth control. See you in 8 weeks and walked out. That was the whole appointment. Turns out I had a tumor on my adrenal gland. Found out when I had a CORT scan for a kidney stone. And I have stage 3 adrenocortical carcinoma. I'm so sorry. I heard similar for years when I was telling docs I didn't have an feeling in my right side. Not my story but a friend's. She was 14 and had extreme pelvic pain. Doctor says probably a bladder infection. She went to a different doctor a few months later after losing weight randomly. You know where this is going. Long process but eventually at 15 she was diagnosed with ovarian cancer, which one of the nurses at the first doctor visit suggested, but the first doctor said no, only old women get that. Complaining to an OBGYN about heavy periods, and while gaslighting me that it's only bad if I go through X amount of tampons. I said I go through X amount of pads, a lot. Not really a tampon person. And her response with full raised judgy eyebrow pads. Well then IDK, what to tell you. If you decide you want an IUD let me know, and ended the visit. I was used to doctors totally disregarding my issue, but now we are going to gaslight and pad shame at the same time. No ma'am. Never saw her again. This is literally the first time I've heard of pad shaming. Is this common? Some people have the belief that pads are for children/teens and adults only wear tampons. I've met a handful of people who believe this and none of them knew each other. I guess these people are unaware that the preferred hygiene product of adults is whatever the F they want. Because they are adults. 1. Told me my child's warts were genetic. 2. Asked if I was trying to get pregnant when seeing my medication history of metformin because that's what metformin is for. 3. Accusing me of being a pain-seeking alcoholic Hep C plus patient in the emergency room instead of checking for the many gallstones I had clogging things up. After 3 weeks, 3 ER visits, and 3 negative hepatitis tests they day shifted an ultrasound. Isn't metformin for diabetes? It is. And for insulin resistance, and pre-diabetes, and most recently weight loss. A few years ago, my wife had kidney stones which led to sepsis. A quick recovery from the sepsis, then surgery for the kidney stones. In the middle of all this, the surgeon needed her medical records and her primary care doctor's office wasn't responding. So I called to arrange to pick them up myself, and the doctor told me that I needed an appointment. And I said no, I don't think you understand. I'm not the one who's sick. They said, I know, but we require an appointment for you to pick up her records. You mean an actual billable appointment where you bill the insurance company and charge me a copay, even though there is no examination or illness and I don't need to be seen? Yes. So you're engaging in what sounds to me like extortion and insurance fraud. I'll stop by and the records had better be there, with no appointment. If they aren't, I'm calling the Attorney General's office. And while I'm at it, I've noticed that your hiring practices are interesting. You only employ women. And only white women. I'm sure the state would take an interest in that as well. I got her medical records in 5 minutes. I would have reported them anyways. You managed to scare them. But the youngest person might not know it's weird at all. I'm from Mexico and went to New Orleans for vacations. I ate a jambalaya and had food poisoning. Ended up in an ER. When I told the doctor I'm from Mexico, she asked, "Did you drink water in Mexico?" My brain froze. Does she think we don't drink water and just die? Does she thought I said I'm a tourist that went to Mexico and drank from the sink? Does I look like I live on the street? Then I proceed to tell her I only drink Coca-Cola. She just said, "Oh, me too." When you're in the US and say something unbelievably stupid to make a joke and people just relate to it. I have extreme period cramps. Went for a painkiller. The doctor said it'll go away after you get married. After I become sexually active. I already am. P.S. Doctor was a woman. I called the doctor to tell them I'd been raped. I was told in an unempathic reply back that I needed to call the police instead. I chose the doctor after hours of finding the courage because it somehow felt a more private/gentler way to approach the utter shame I felt in calling the police. I felt further violated after the complete dismissal of my GP. No one felt safe. I called no one beyond that call. I got a standard check after being raped by a group of men. It was difficult, but I braved the appointment. I had something. The doctor told me I needed to contact them and tell them to get tested. I told them they wouldn't be possible. They said I was selfish and would be responsible for thousands of cases. He never even asked me if I'd consented to it. JFC, what the absolute hell is wrong with some people? At Children's Hospital with chronic pain. Homeschooled starting freshman year because of it. When I had been an app student. On track to graduate early, and she tells me and my mother that I wasn't actually in pain and I was trying to get out of school. Been 5 years and I'm still experiencing chronic pain and I hardly graduated because of it. I was probably 13 or 14 at the time and I was having horrible sharp pains in the side of my hip, like a grinding almost. I put up with it for a few days and then I finally couldn't take it anymore. Walking was painful and I was keeled over most of the time. So my mom finally decided that I needed to go to the ER. Was there for like 5 hours while they ran tests trying to see what was wrong. One of the nurses' bedside manners weren't very good and they kept saying it was my appendix even though the pain was on the wrong side. The male doctor finally came in after all the tests. He said they didn't find anything and that it was probably just my period. WTF, I was not on my period. I knew what cramps felt like and that was not what I was experiencing at all. My mom was mad and we just left after that. The pain went away after another few days and I never found out what was wrong with me, but I have a feeling it was an ovarian cyst. Those are horrible. My first one burst. The DRs thought it was appendicitis and almost wheeled me to the OR. The doc decided to do a last minute ultrasound and yep, burst ovarian cyst. Worst pain ever. And they can't do anything besides pain meds. I was struggling with some chronic crushing leg pain and doctors couldn't figure out what it was. I had one visit with a GP where I once again was told that nothing is wrong with me. I asked that maybe they could send me to a specialist. She answered with yeah. Like who? Who could treat you that we can't? Like I just insulted her. I was 3 weeks into sobriety. I was open and honest with the doctor about it. He asked me how long I was sober. I said happily 3 weeks. He then says, "Then why can I smell alcohol on you?" I felt so defeated, angry, unsafe and unheard. Sobriety is hard enough on its own. But when this self-absorbed S-head doctor said that, I wanted to give up. This conversation happened after he asked me about my interests in my career. I told him I love working with kids and that I want to be a counselor. The endocrinologist told me that victims of sexual abuse couldn't be helped and are so messed up by the time they're adults. He said that's why working with kids is better, so they have a chance. I never went back to him again. In his office I told him that it was offensive and I told him to be careful who he says that to. Just because it's not in the medical record doesn't mean the person in that chair across from them isn't a survivor themselves. F that guy. A couple years ago I switched doctors. I've had a regular Adderall prescription for years, since I was diagnosed with ADHD. We were discussing how much I take, and he seemed concerned that I was taking 30 milligrams a day. I told him my Adderall prescription was meant to be for everyday use, because I need it almost every day. To which he responded, yeah, but it's good to take mini vacations from it. I told him that I don't take it on days I don't absolutely need it, but I'm a full-time student and my health is a concern when it comes to re-establishing tolerance after these vacations. My last doctor and I established over years of visits that it was better for me not to go too long without taking it because my weight drops like a rock when I don't eat. And if I haven't taken it in a couple days it kills my appetite for the next few days and it's a struggle to force feed myself just to not lose too much weight when I'm already very skinny. He raised his voice and blew up at me. Then you're not going to keep taking it if you aren't going to take it how I tell you to. I barely knew how to respond. My face must have been bright red because it was just like how my dad used to scream at me. Rant, why do some doctors and random people act like everyone who is prescribed Adderall is some junkie who needs to be limited as much as possible? I've been taking it exactly as prescribed for years. I don't sell it. I don't misuse it or anything. I need it. It's the difference between when I was straight D's and F's in high school struggling and straight A's and B's now in college. If I had been diagnosed and prescribed this sooner, maybe I cold went to an actual good college and done something with my life. I was never dumb. I have a mental illness that makes the education system ridiculously hard. You'll insist on locking me on hard difficulty mode by putting a shitty stigma on the disorder and the medications used to alleviate it. It's not meth. It's like everything caffeine wishes it was and nothing more. Motivation, energy, calmness, pure focus. It's not the same if you don't have ADHD, but I was literally diagnosed and prescribed this medication. I'm not trying to get high. I'm trying to get by. I'm sorry that you went through this with this doctor TBH. As someone with ADHD I can totally relate that we are definitely not trying to get high, but just to function. Yep. All the regular people who abuse it are the reason it can be such a pain in the ear to get. Told me I should listen to my boyfriend at the time because he is more mature than me. Had nothing to do with our visit at all. I was just telling her my symptoms and he was trying to do it for me. He didn't defend me, just smiled. TBH I broke up with him because he was a man-child. If you walked in here, you don't need Ray, and then coming back after I demanded Ray. Yeah, I'm sorry. You want some morphine now? I'm late to the party, so I expect these to get buried, but here goes. NP switched my antidepressants to Lexapro when I was 15. Took it for a month. Turned into a zombie. Wasn't sleeping or eating. Very catatonic. Next checkup, I tell her I don't like how it makes me feel and I'd like to stop taking it as my therapist agrees it wasn't helping me. She proceeds to berate me for minutes about how I can't run away from my problems and stop taking them because they make me a little uncomfortable. My mom and I just walked out. A year or so later my mom and sister took me to the ER for a suicidal episode. While waiting in fridge my mom left my sister with me while she went to the car to retrieve my therapy handbook and meds, and while she was gone I was having a panic attack. The security guard threatened to tase me if I got any crazier. When my mom got back and the ER doc finally came in, he said I was on my period and hormonal and was just doing this for attention. They then sedated me and made me lay on a cot in the fridge hallway for 10 hours until the social worker got there. At that point I was so drugged I couldn't answer any of her questions and she reported I was just tired and needed to go home and sleep. Holy shit. At age 13, I found the courage to tell my very strict religious mother that I was sexually active and needed birth control. She took me to her own gynecologist. Due to my age, I was required to have either my mom or the nurse in the exam room. I chose the nurse because my mom and I were not close like that. The doctor was so rude, rough, and condescending. He spent most of the exam making fun of me to his nurse. At one point he said, "I'm going to need you to open your legs wider for me. I guess you hear that a lot." Huh. Again, I was 13 years old. Wow. But congrats for having the courage to tell your mom. That's impressive. When I was little, my doctor asked me if I drank alcohol, and then followed up by asking if I do drugs. Normal things to ask. But when I responded no, he asked me why I was opposed to having fun. At the time I thought it was kinda funny, but my parents were pissed. My physician had recently divorced, very bitter, and lost a lot of weight afterwards. I'd been seeing her for some time before I got to the point where I was ready to make some changes regarding weight gain. After having my son, while discussing weight loss plans, she tried over and over to get me to agree to try phentermine. Apparently that's what she had taken. After researching and discussing with my husband in depth, I explained I wanted to stick to exercise and nutrition. Multiple times we had this conversation. Finally, at my last appointment with her, she said in a huff, "Well, I just hope your husband doesn't divorce you before you figure out I'm right." That was my last appointment with her. I immediately found a new doctor and blocked her as she kept trying to contact me. My doctor told me I had chlamydia because it was burning when I peed. I told him I've been with the same woman for 4 years. He asks if I cheated. I say no. His response was, "Well then she cheated on you." I asked if I could be a UT, and he said men can't get UTIs, and ran an STD panel. Needless to say it was a UT, but through a strange set of circumstances the doctor's office ended up telling my father with a similar name that I didn't have chlamydia, and then he had to tell me, "Kaiser permanent sucks." When I asked for my tubes to be tied, my doc said, "You only have one child. What if something happens and you wanted to replace them?" I replied with back quote, "How in hell do you replace a fucking human being?" I got my tubes tied 6 months later. My doctor refused, 4 years, to let me get an IUD, even though I was in my 30s, married, and had made it clear I didn't want children because you might get an infection from the IUD, and it could mean you never have children. Like, dude could just not accept I don't want kids. He is no longer my doctor. Same for mine. I got an infertility diagnosis, like I don't have a woman fertile, and he was trying to set up appointments to find out if I have eggs and how to freeze her for the future. He even suggested a womb transplant after repeating the fact I really don't want / like children. My long-term partner doesn't want them either. I have a phobia of labor and pregnancy, and if I ever did change my mind I'd adopt. Highly unlikely, but I think adoption is beautiful. Yes, but what if you meet a man in the future who wants children? What would you do then? I think I'd dump him. Whoa. Uterine transplants are a thing. Get mine out of me. I don't want it. Yup. He went on to tell me of a successful birth after a woman with MRKH. What I got after she got a transplant. I know a lot of women who'd say the same thing. Actually, I see many fighting for it because DRs think they know better than them about their own reproduction choices. I went to the doctor with strep throat. I had a fever of 101.7 for one whole day. Never broke it. I couldn't breathe well, and my right side of my throat was swollen, making it difficult to swallow and eat and drink. It hurt to talk. I was whispering. White dots all over. I thought it was tonsillitis. Anyways, I said it hurt, and he said that's good, and even the nurse commented, "What do you mean that's good? That's not good." And I laughed and responded, "I mean I guess it's good. I'm still here. I just want to feel better."